Dr. Fankhauser, I heard a lot about one-day implants or instant implants, whatever it is called, and yet some doctors say it takes 4 to 6 months for the metal stick to go in and kind of like take roots, and then you put the crown on it. Why would anybody do that if there's such a thing like an instant implant, or are there candidates for one or the other? Can you shed some light on this?
I certainly can. The difference a lot of times depends on the quality of the bone you're putting the implant in. Okay, if the bone is kind of soft, let's say, then you're going to have to let that implant grow in, or let the bone grow in around the implant before it can support very much. If you have pretty good solid bone, and there's places where you can put an implant in, put a crown on it, as long as you keep the bite kind of pretty light on it, so it's not under much stress, and it'll work fine. But implants all take 4 months or so, 3 to 4 months for the healing to occur. So, people don't want to be without a tooth. So if it depends on where it is. If it's in the front, you don't want to be without a tooth there. So we'll try to put something on that implant right away if we can. If we can't, then we have to put something in to hide it, hide the space.
I see.
So
basically, when you see advertised one-day implant, not everybody will then qualify for it once you get there.
Right.
And
that's right.
And like with most things, like if you pour a foundation in a house, or especially if it's a big high-rise also, you want to have it sit for X amount of time to make it sit. Otherwise, everything else you build on it basically cracks.
Yes. A one-day implant, if it's not built and put in the right place, it may last till you get to the end of the parking lot, but beyond that, who knows?
Well, maybe it gets that one person through the wedding he wanted to do it that night. If that was the purpose, I guess it did its job, right? But I'm sure a little temporarily plastic tooth just faked on, and the patient knowing not to bite on it would probably do the trick for that one day also, and then go for the real thing and take the time, right?
Yes. Yeah, but implants work very well, but you got to use your head and put them in and getting things done correctly.
Well, all right, like everything else. Well, thanks for shedding some light on that one. Thank you very much, Dr. Fankhauser.
All right. Thank you,